Antrochoanal polyps, also known as Killian's polyps, are fascinating yet often overlooked lesions that primarily affect children and young adults. These benign growths account for about 4 to 6% of all nasal polyps in the general population, but their prevalence skyrockets to around 33% in pediatric cases. So, what exactly are these polyps and why should we care? These polyps originate from the hypertrophy of the maxillary sinus mucosa, particularly near its ostium. As they develop, they can grow through the maxillary sinus and into the nasal cavity, sometimes even extending into the oropharynx. The rapid growth of these polyps is likely due to venous compression at the ostium, which causes the polyp to become edematous. This is a key point to remember, as it helps explain their behavior and symptoms. Clinically, the most common presentation is unilateral nasal obstruction. However, in more severe cases, they can lead to bilateral obstruction and even nasal septum deviation. Patients often report mucus or mucopurulent nasal secretions, and if the polyp obstructs the eustachian tube, it can result in secretory otitis media. While epistaxis is rare, it can occur, adding to the complexity of the clinical picture. When examining a patient, we can often visualize the polyp using anterior rhinoscopy or a nasofibroscope. Typically, the polyp will be seen exiting the middle meatus and extending into the choana or nasopharynx. This visualization is crucial for diagnosis, but we also rely heavily on CT imaging. A CT scan will reveal a homogeneous opaque mass filling the maxillary sinus, the ipsilateral nasal cavity, and potentially the nasopharynx. This imaging not only aids in diagnosis, but also helps us plan the surgical approach. Speaking of surgery, endoscopic surgery or microsurgery is the primary treatment method for antrochoanal polyps. However, recurrence is a significant challenge, which is why thorough exploration of the antrum during surgery is essential. Even with careful removal, these polyps can come back, making it vital to understand the anatomy and ensure complete excision. Differential diagnoses are also important to consider. We must distinguish antrochoanal polyps from retention cysts, mucoceles, maxillary sinusitis, and even meningocele or encephalocele. Each of these conditions has its own implications for treatment and management, so a careful evaluation is necessary. In summary, while antrochoanal polyps are benign, their impact on patients, particularly children and young adults, can be significant. Understanding their pathophysiology, clinical presentation, and management strategies is crucial for any medical professional involved in ENT or pediatric care. The journey from diagnosis to treatment requires a comprehensive approach, and staying informed about these polyps is essential for effective patient care.